Dear students, welcome back. In this session, we are going to discuss about TENS, that is transcutaneous electrical nerve stimulation. It is a simple, non-invasive analgesic technique used extensively by physiotherapists in clinical settings to reduce pain of any origin. And the current is often generated by small battery operated machines in which circuits modify the battery's output in such a way that it will have a stimulatory effect. Okay, and this is the application of pulsed rectangular. Here you can see the pulsed rectangular monophasic. So this one is monophasic, and here you can find the biphasic. Monophasic or biphasic currents with the pulse duration of 50 to 200 microseconds and frequency of 1 to 120 hertz, and also as high as up to 200 hertz also, and a maximum peak current of 50 to 100 milliamperes applied through surface electrodes primarily for pain control. Though the waveforms could be monophasic and biphasic, the biphasic pulses are the safest for use as there is no net direct current component. Okay. So this is about the introduction of TENS. Now we will see the types of TENS. Okay. Yes. Here you can find different types of tenses. So the type of TENS are high tense, low tense, burst tense, and also modulated type of TENS. And another type of tense here are the intense tense. So this intense tense is also called as brief intense tense. Okay. So now we will see one by one. Okay. Yes. So the first one is the high tense. This one is also called as conventional tense. So these are all the types what I have mentioned, or types of modes in the tense. So now we will see the first one, that is conventional high tense. So here the high frequency low intensity is used. High frequency low intensity type of currents are used here. Okay, this is the most commonly used mode of TENS. The aim of this application is to activate selectively large diameter fibers. Large diameter fibers, that is A beta fibers, without activating the small diameter, that is A delta and C fiber efferents. Okay, it is effective in modulating acute pain. So in acute pain, conventional TENS is used. The modulation of pain is via inhibition of pain fibers by large diameter fibers activation, that is gate mechanism. So pain gate mechanism, here it is by blocking the small diameter fibers and allowing the impulses of TENS through the large diameter fibers. Okay. So the onset of pain relief is relatively fast. Okay, and we will see the parameters and the dosage after this modes. Okay, next type of TENS is called as low TENS or acupuncture like TENS. So commonly it is having a common misconception that this mode derives its name from application over acupuncture points. Okay, here we are using low frequency and high intensity. Low frequency and high intensity of currents are used. Okay, and this TENS primarily stimulates group 3, that is A delta, and group 4, that is C nociceptive fibers. Okay, so this is about the low TENS. And also this low TENS is primarily believed that the pain is suppressed by stimulating the descending pain suppression system. Thus, there is a relatively longer onset to analgesia, which lasts more than the conventional TENS. Okay, so the low TENS acts at which level? That is extra segmental level. So low TENS is acting at extra segmental level, that is which is acting at the descending pain suppression system. Okay. Next, another one is the burst TENS. Next one is the burst TENS. This mode of TENS was developed by Erickson in 1976. The burst mode provides a packing of several stimulus in groups ranging from 1 to 10 and is presented in bursts of energy sensed by the patient as a single stimulus. This combines characteristics of both high TENS as well as the low TENS. Okay. Pain relief is through the stimulation of endogenous opiates, that is low TENS, which is activating the descending pain suppressant pathway. So, where the opiates are released. Some patients prefer this mode because the pulse trains produce a more comfortable muscle contraction, and the current here is more tolerable than the low TENS. Okay, so and another one is the brief intense TENS. So here we can see the intense TENS, how it is applying. So the waveforms are like this. So this mode is used to provide rapid onset but short-term pain relief during painful procedures which are done by the clinicians, such as wound debridement, joint mobilization, etc. So that is about the intense TENS. Another type of TENS or the modulated TENS. So here the amplitude of the waves are modified, that is called as amplitude modulated. If you are modulating the frequency of waves, then it is frequency modulated, and if you can modify the duration of each pulse, then it is called as duration modulated type. So there are different kinds of TENSes are available in the market nowadays. Okay, yes, these are all about the types of TENSes. Now we will move on to the treatment parameters for the TENS. Okay, before we'll see the treatment parameter for TENS. Normally there are several types of advantages of TENS. One is non-invasive and it is portable, user-friendly and safe to be used. And it is used in long-standing pain syndromes, and it is very cheaper than the regular prescription of analgesics. And change of battery and electrode is the only extra cost once the machine is purchased. And the precautions and contraindications are few and side effects are minimal, and it is non-addictive. If we see the disadvantages, a number of patients fail to tolerate the sensation of electrical stimulation and fail to respond to this program. Another one is the skin irritation due to any allergic reaction or any chemical burn may result. if you see the techniques of application of TENS, the first thing for every electrical equipment, okay, in therapy, so first we have to prepare the patient, and then electrode placement of the TENS for the patients, and now the next one is the selection of treatment parameters. Yes, now we are there in that position, that is treatment parameters for TENS. Okay, yes, here these parameters we are used for both acute and chronic pain can be treated with TENS. But quite often the patient's symptom will dictate which pulse frequency to be used. For example, a patient who has sustained an acute soft injury of the shoulder may not respond favorably to low frequency TENS, which would cause a pulsating contractions in the already traumatized muscle. Then the patient is not comfortable with such kind of TENS. So we have to choose according to the patient's tolerance also. But these are the common parameters, treatment parameters for TENS. So what are the parameters here we are going to use, we have to consider is the frequency, how much frequency we have to use, what is the pulse duration, amplitude, and the treatment duration. So we are having 4 types of TENS. One is high TENS, low TENS, brief TENS, and burst TENS. The frequency for high TENS is 80 to 120 Hz, and the pulse duration falls 50 to 80 microseconds. Amplitude, strong tingling below motor threshold. We can extended period of time. Okay, so according to the patient tolerance, we can extend the time also. If you see the low TENS, the frequency is 2 to 5 Hz, and the pulse duration here you can see is 150 to 300 microseconds at or above motor threshold amplitude, and the treatment duration is 45 minutes. If you see the brief intense TENS, the frequency is 125 to 250 Hz. This is somewhat a very intense TENS. And if you see the pulse duration, which is also 200 to 250 microseconds, and highest tolerable amplitude, and the treatment duration is 15 minutes or even less. If you choose the burst TENS, the frequency is 50 to 100 Hz, and the pulse duration is 50 to 200 microseconds, which is comfortable intermittent paresthesia, and the treatment time is 20 to 30 minutes. So these are the treatment parameters, or we can take the dosage parameters for TENS, different kinds of TENS. Now we will move on to the indications and contraindications. So here the indications, mainly the TENS is having mainly analgesic effect, that means pain relief. So indications are mainly which are related to pain only, that is acute pain, chronic pain, and different other kinds of pain, that is post-operative pain, obstetric pain. So in the case of acute pain and the chronic pain, under this we'll get so many different kinds of pain. For example, low back pain, musculoskeletal pain, arthritic pain, like that we can consider in acute and chronic pain. And also the post-operative pain means which is also acute, which is localized and lasts up to 72 hours, is treated successfully by the application of TENS. And obstetric pain, that is the use of TENS as a form of analgesia for delivery, is growing rapidly nowadays. Okay. Yes. So the intensity of pain as well as the area of perception varies considerably during the different stages of labor. Okay. So it is now the tense is using as a form of analgesia for delivery. Okay. So these are the different kinds of indications, and it is also having some non-analgesic effects for this tense. One is it helps in fracture healing. You can put it on uses. So it helps in fracture healing, and anti-emetic effects also present. Okay, and this one also helps in improvement of blood flow, and different kinds of pains. Not only I have mentioned some pains like low back pain, neck pain, no. And also there are different kinds of pains, that is post-hepatic neuralgia, causalgia, peripheral nerve disorders, facial pain, metastasis pain, bone pain. The pain is due to cancer. In that case also the TENS is used only for pain relief. Okay, and also orofacial pain, headaches and migraines also we can use TENS. Okay, and now if we see the contraindications to the use of TENS, here the first one is the anesthetic skin. The first one is the anesthetic skin. A simple, short, blunt test will determine about the presence of intactness of cutaneous innervation to that area. If sensation is absent in a particular area, this does not prevent the patient from treatment with TENS. The electrodes may be placed proximal in an area with intact sensation. Okay, and then over carotid sinus, electrode should never be placed over the anterior aspect of the neck, over the carotid sinus, as stimulation of this area may reduce the blood pressure. Okay, that means it may cause fall in blood pressure, we can say it. Another one is the pregnancy. This generally refers to the placement of electrodes over the pregnant uterus. However, some sources recommend not using TENS for any painful area during pregnancy, despite the fact that no adverse reaction to TENS during pregnancy has been reported till date. However, the use of TENS towards the end of pregnancy, that is labor, is made to induce painless delivery. Okay. And next one is patients with pacemakers. The patients with pacemakers usually contraindicated for TENS. Okay. So there are so many studies have been done on such kind of patients, and they indicated that TENS can interfere with cardiac pacemakers of the synchronous type, but that it is safe to use TENS with asynchronous fixed rate type pacemakers. Okay, so nowadays such kind of pacemakers are rarely used. So these are some findings, but better not to use TENS the patients with pacemakers. And patients with allergy, if the patient has an allergic reaction to the electrode gel or tape that persists at the time of treatment also, TENS should not be applied with these materials. Okay, and in the case of epilepsy, patients who have epilepsy should be treated at the discretion of their clinician. That means only with the physician's suggestion only we can treat for epilepsy patients. Okay, and also TENS should not be advised while driving or any operating machinery. So these are the indications and contraindications of the